We are continue. The second topic today about herpes infection is very hard topic, and at a herpetic infection there is disturbance of homeostasis in the form of imbalance of coagulation and anticoagulation system of blood. Changes in the oral cavity is case of viral diseases are mainly of inflammatory nature. They depends on the clinical course, the general condition of the child's body, and presence of irritants complication, the clinical course in the oral cavity. This is one of pathogenetic aspects is consistent with the pronounced system of bleeding of the mucous membrane of the gums, of mouth, and sometimes of nose, with acute herpetic stomatitis. Pathological changes in homeostasis can lead to intravascular thrombosis. It is assumed that necrotic areas in organs and tissues in herpes infection occurs as a result of birth direct destruction of the cells by the virus and due to capillarity thrombosis. In the epithelium of the mucous membrane develop reticulum and belonging degeneration, the result of which is intraepithelial necrosis. So appearance areas of superficial necrosis in the oral cavity is a form of papules or plaques. So, for example, dry necrosis. Exciting short-term blisters with clear or cloudy content, so wet necrosis, and often preceded by spots of hemorrhage. With viral damage to stem cells involved in collagen synthesis, it is associated disorders with them thyroiditis of connective tissues of capillary walls and hemorrhagic pneumonia in the field of herpes lesions. And clinical manifestation of acute herpetic stomatitis in children. So, according to many authors, this type of stomatitis we can see in 80% in children. So, etiology. The disease is caused by DNA containing herpes simplex virus. And you should know about general degrees intoxication and local. It is severity of lesions in the oral mucous nature. And clinical cases in our slide. Then the mild form of this type of herpes. Children of 6 months to 3 years old are the most often to get the virus, but the disease may also occur in older children. Children with acute or recurrent form of the diseases and adults are the source of infections. The infections can be transmitted by contact or in saliva droplet by air. As typical infection, this infection develops in 5 periods. So it is first period incubation, prodrome period second, the third peak, and then fading, and clinical recovery. The incubation period lasts from 2 to 17 days. Trauma of the covering tissue can promote the disease development. And having penetrated into the child's body, the infection agent begin replication in cells of local tissues and adjacent lymph nodes. So after the local infections, the virus can spread through hematogenic or neurogenic ways. Having accumulated in various organs, it is lively, etc., and tissues, the virus causes their infection forming necrotic areas. And clinics, so depending on the degree of manifestation of the clinical symptoms, three forms of herpetic stomatitis are distinguished. It is mild form, moderate, and severe. The disease is characterized by the general intoxication, expressed inflammatory reaction of the oral mucosa, and depressed local immunity. The disease is often characterized by lymphadenitis of submandibular lymph nodes. The lymphadenitis, presence and development of stomatitis and lasts for 7 and 12 days after epithelialization of the oral cavity. The diseases start with a raise of body temperature to 70 to 37.5 and 39 degrees. In this period, the general condition of the child worsens and weakness, headache, skin paleness are observed. So hyperemia, bleeding gums, catarrhal gingivitis, for example. Catarrhal angina are defined in the oral cavity. And in a day or two, single or multiply rash elements appear of the background of increased hyperemia. The elements locate on the oral mucosa of lips, cheeks, tongue, soft and hard palates, and gums. There are areas of superficial epithelial necrosis or vesicles from 1 to 3 millimeters in diameter, with transparent or muddy content. In case of mild form of the disease, there are from 3 to 5 erosions, relapse, or rash elements are absent. The disease lasts for 7 days. Typical herpetic vesicles appear on the skin, around the mouth, and blepharones and eye lobes. The elements merge and form large erosive areas. Their number depends on the severity of the diseases. And medium form is characterized by longer development, 7-12 years, presence of 5 to 15 rash elements. And there relapses for 2-3 times and more expected intoxication. Cases of a severe form are much rarer. The child's body temperature rises to 39 to 40 degrees. Significant areas of the mucous membrane are affected due to the large number of elements. This form is characterized by multiple relapses of rash. Catarrhal gingivitis turn into the ulcerative necrotizing one, and serious changes in the oral cavity are accompanied by inflammation of nasal and respiratory tract of mucosa. Significant intoxication is observed, and often disturbance of blood circulatory system, and digestive tract occurs. So acute pain in the affected areas and after are the typical features of this diagnosis. Period of clinical recovery is characterized by decreased inflammatory manifestation and disappearance of fibrinous coating from the lesions of epithelialization of the erosive elements. And diagnosis based on the following data, for example, features of clinical manifestation, anamnesis, and results of virological, serological, cytological, and immunofluorescence examination. At the degeneration stage of cytological tests, reveals typical giant multinucleated cells, and their size may exceed the sizes of normal epithelial cells. And the basis for identifying the risk are direct and indirect data of the quality of a child's immunity. So Melnichenko and Plotnikov developed a tabular version of the forecasting system and taking into account 5 most reliable anamnestic signs of immunodeficiency and local provoking factors. Peculiarities of the pathogenesis and clinical course of acute herpes infection have been established in children at risk. And this group occurs in only 2 forms, moderate and heavy. The disease is characterized by temperature and prolonged hypothermia. So pronounced toxicosis, a combination amazed with mucous membrane and laser, multiply merged elements of defeat the oral cavity and severe immunodeficiency. And it is example of the card. So first of all, it is full name, their number of medical history, gender, address, phone number, phone, and all information about address, about school, about children's preschool, and signs and expressions. You should know about acute herpes infection in newborns. It is can be consequence infection in the womb, so 5% of newborns with herpes infections, in birth canals 80% of cases, and after birth from maternity ward staff. Look this. And herpes infection of newborns can develop in localized and disseminated form, and in each of them there may be a defeat of mucous membrane, and localized form of infection defeat eyes, skin, mouth, and disseminated form of infection also herpetic lesions on the eyes, skin, mouth. Clinical and pathological manifestations of congenital herpes infection are registered in the first hours of the life of the newborn and are characterized by polymorphisms. Important sign of intrauterine infection are herpetiform skin lesions at birth. The incubation period of perinatal herpes infection of newborns is on average 2 to 6 days and ranging from 2 to 30 days. Localized lesions of the skin, mucous membranes of the eyes and mouth usually appear for 10 days after birth. Most children have hemorrhages of the soft palate and pharynx, increased vascular patterns, and mucous, the shell of mouth or normal color. So, how as a rule, two elements of defeat are observed and much less often on 3-5 elements. Elements lesions can be localized on the oral mucous membrane of the gums, of the red border of the lips, of the palatine arches, and very rarely on the tongue in the form of single vesicular rashes. The vesicles open quickly and form small erosions on the slightly infiltrated base, and from 4 and 8 days after onset, epithelialized these erosions. And with localized herpes infection in newborns, there are usually vesicular, single, or grouped rashes and spotted erythema of the skin, of the face and limbs. And their vesicles open quickly and form small erosion of the infiltrated base. And clinical and laboratory diagnosis of herpes infection. Sorry guys, clinical diagnostics. Acute herpetic stomatitis is made on the basis of a set of data, so information from anamnesis, clinical picture, clinical data obtained ex genibus, and for example, acute herpetic stomatitis, severe form, hot stage. It is about diagnosis indicated of type of infection, nature of this infection, and form. We can do in cytological research, virological, polymerase chain reaction, method of probe of genes, then reaction immunofluorescence, enzyme-linked immunosorbent assay analysis, and radioimmune analysis, and the end immunoblotting. Several doses, different methods are used, but for successful laboratory rapid diagnosis for herpes infection, it is necessary to plan the simultaneous study of material taken from several areas of the lesions in different ways. So, virusological method. Please look. It's using cell culture method. The virus is isolated more often from vesicles than from erosions, and at primary defeat, the virus is found in vesicles 2 to 7 days after the first displays. At secondary activation for 4 days, and at immunodeficient stages up to 21 days. Microscopic method. It is cytological diagnostic and direct and immune electronic microscopy. Methods cytological diagnostic are non-specific. Their sensitivity is about 50% when conducting a cytological examination. It is impossible to differentiate viruses herpes simplex, and such the same has the advantages and electronic microscopy. So research method. Biomaterial we can use smear from the lesions and compare nuclei of healthy cells. The nucleus of the cells affected by the virus. Oh, please. Molecular genetic methods. Reaction molecular hybridization and polymerase chain reaction. So, with the beginning of treatment with a cyclic analogous of nucleosides, Yes, and this reaction becomes negative on the 5 days. And polymerase chain reaction. So we should research scraping for herpes infection with mucous membrane of the mouth. And non-found, it is indicated the absence of herpetic virus infection and discovered active primary infection or reactivation of the latent stage herpes infections. Immunochemical methods. Reaction immunofluorescence, method fluorescence antibody, method direct immunofluorescence, method indirect immunofluorescence, direct and indirect variants of solid phase enzyme-linked immunosorbent assay, and direct and indirect options immunoperoxidase method. And successful application of methods. Enzyme-linked immunosorbent assay analysis. It is detection immunoglobulin class G to herpes simplex virus first and second types that are indicators of the presence of herpes virus infections. So venous blood we research, and main results, positive results or negative results. Positive means the presence of antibodies, immunoglobulins G, to first and second types of herpes infections, and negative results indicated a low probability of acute herpes virus infection, as well as the fact that the body has not previously been in contact with the herpes simplex virus. However, immediately after infection, when sufficient antibodies has not yet been produced, the result may be false negative. In this case, an additional test is recommended, immunoglobulin class M, and reanalysis on immunoglobulin G in a few weeks. Serological methods are reaction neutralization, reaction breaking, hemagglutination and passive hemagglutination, ELISA, immune blotting, and reaction latex agranulations. So these different methods that I previously slides, and check up herpes general blood tests with leukocytes formula. Bilirubin is common, ALAT, ACAT, and triglycerides, total cholesterol, glucose, creatinine, alkaline phosphatase, blood pressure of the herpes virus, immunoglobulin G, and immunoglobulin M. Treatment of acute herpetic stomatitis must have heterotropic, pathogenic, and symptomatic directions. Because it is a systemic infection with manifestations of the oral cavity in the treatment of acute herpetic stomatitis, use both general and local means and methods of treatment. So, what we should do, necessarily to consider individual features of the child, stage disease development, and present symptoms of concomitant pathology. Objectives of general treatment: it is termination, reproduction of herpes viruses in tissues and environments of the body, reduction symptoms of intoxication, and normalization metabolic processes. Tasks of local treatment: to eliminate or relieve painful symptoms in the mouth, to warn repeat rashes of element of defeat, then to influence of pathogenic associative microflora, and speed up epithelialization elements of defeat. So, treatment tactic: in all cases during the disease, child isolate and exempt from visiting of children's term. And in complexes and medical activities, occupy an important place. It is rational nutrition and proper organization of child care. Food should be complete, so caloric and non-irritating. Before feeding, it's necessary to anesthetize the mucous membrane. The child fed mainly liquid or semi-liquid food that does not irritate the inflamed mucous membrane, and great attention must be paid to the administration and sufficient amount of fluid. Easy-form treatment of mostly local. So for reduction or morbidity of elements of the fetus, possible use to local anesthetics. And local treatment is carried out in the same mode as an hurt, but antiviral drugs replaced by means of promoting epithelialization. And moderate and severe forms, general and local. So non-irritating wholesome food, heavy drinking, antiviral drugs orally. Hypersensitizing preparation, immunocorrective preparation, vitamins, and symptomatic antipyretic drugs. And local, it is anesthetics, antiseptics, enzyme preparations, antiviral ointments or cream, and agent having immunomodulatory and interferonogenic properties, and astringent. Treatment severe of herpetic virus are often performed in a hospital setting to create adequate replacement conditions. Tableted forms of antiviral drugs for infection and organization detoxification and regurgitation therapy and parenteral nutrition. So, and general treatment, it is preparation acyclovir. These examples of our medications. So, Virolex, Zavirax, Medavir, Acyclovir, table, and Ibamidine, Valtrex, and Famvir. Immunotherapy of herpes infection, interferons. So it is infected cells and induced interferogenese. Funds substitute deficient immune factors, so interferon, different of classes B, A, and immunoglobulin human normal. Agents that stimulate the production of activity of interferons. Cycloferon, so in tables. Tablets, yes. Numerous 10 and different concentration. And groprinazine. Interferonogen has an immunostimulatory and antiviral actions. And tablets 500 milligrams, a point inside after meal, and daily dose for children 50-100 milligrams to kilogram. Immunostimulants or adaptogens, imudon, immunal, pentaxyl, methylurathyl, and different concentration for years. Okay, and look please to these medications. Immunocorrectors are Lysapid, Lycogen, sodium nucleonate, Timagen, Timalin, Timostimulin. And also write in your synopsis tablets and how many times to a day we should prescribe for children, and concentration of these drugs. Then hypersensitizing preparation: Tavigil, Suprastine, Pipalfan, Diazolene, Claritine, Fencarol, Peritol, and Trexil. Also look to the dose. Drugs with analgesic, antipyretic, anti-inflammatory effects: paracetamol and ibucline. And paracetamol, Panadol, Tylenol, and Calpol. In different tables in different form of this medication. It can be tablets, it can be syrup, it can be powders. Yes. Multivitamins complexes, and these complexes you can buy in different countries and in Ukraine. This Supradine, for example. Then drugs for local treatment, local anesthetics. It is emulsion, special anesthetic emulsion, 5-10% of anesthetics. Then Calgel, jelly Dinexam, Desensil, and 5% paramecaine ointment. And this medication you can buy here in Ukraine. Drugs for local treatment, antiseptics found: it is chlorhexidine bigluconate and chlorphilipt, spray or recept, actinisept, mondizal gel, then gel metergyl dent, preparation medication herbs, different herbs, and listerine. Drugs for local treatment: it is enzymatic drugs, proteolytic actions, trypsin solution, himatrixin, territylene, pancreatine solution. Remember please, because some of these local drugs can be in tests. Drugs for local treatment: it is a solution of deoxyribonuclease. Then antiviral drugs: Viralex, cream, endpoint. Then herpes 5% cream, Savirax, Aciclovir, Medavir, Herpetic, KMP, Acegirpin, and herpes, hygiene herpes, Banafton, oxalinic solution, idaoxyuridine, and means having immunomodulatory and interferonergic properties, adaptogens. Vifuron. Also look please to concentration, to prescribing for a day, and how many days should be the course of treatment. Interferon, Reaferon, 1% solution of Valazan and 5% cycloferon liniment, 3% megacine ointment, and Derinalt, Lysozyme solution, and water Japanese Sephora tincture solution. Then isolators epithelialization. It is carotenoids, beta C, buckthorn, beta dark rose, sulcoceryl dental adgative paste, activigene, then vinyl, 5% oil solution of tauroferol acetate, then retinol acetate, liniment of aloe juice, and olazole. Astringents: 1% tannin solution, glascarpine, decaction, strong tea, brewing, and decaction. Jones wort, and infusion sage herbs. Treatment in physiotherapeutic treatment, and first it is ultraviolet radiation in the first days of the disease after lowering the temperature. Then helium-neon laser radiation, appointed in all period of disease, and analgesic, epithelialization, desensitizing, and immunocorrective, and anti-relapsation. The radiation of the helium-neon laser and course of therapy should consist of 5 to 7 sessions is moderate and 10 sessions for severe. Infiltrations, so 0.1% solution deoxyribonuclease and 5% ascorbic acid solution, alternating them every other day. And prevention of herpes stomatitis, the dentist should care to take certain measures to prevent the spread of herpetic stomatitis, and which are important for protecting the health of young children who do not have a proper level of immunity. For the prevention and pre- and intranatal infections, the dentist should draw the attention of the pregnant woman suffering from herpetic virus and the obstetrician observing her environment, virus isolation for a child. Consider the questions. Yes, and to prevent adequate anti-herpetic treatment, heart center control, use masks, only personal hygiene products, control clean hands, prohibition of kisses and sampleless baby food. Preventive anti-herpetic treatment, regular to ventilate, disinfect, to conduct daily examination of children to identify patients, to accept measures to isolate sick children, and to children who were in contact with patient within 5 days to treat mucous membrane with antiviral ointments. Tactics. So traditional, general and local treatment is necessary to apply. Medical examination of children are so different form, and one and second dispensary group and the dentist, and frequency dynamic monitoring depends on the severity of the disease, and call children at risk 2 times a year. Thank you for your attention, guys. I wait for your synopsis. If you have some questions, please write in Google Class. Have a nice day. Goodbye.